Joining us now is someone who, for the last several years, has been at the absolute center of these questions. Dr. David Kessler is the Chief Science Officer for the Biden administration's COVID response, and he'll be in that job for just a little while longer. Dr. Kessler has announced that he will be leaving his post in the Biden administration soon, this week. He joins us now to talk about it. Dr. Kessler, thank you so much for being here. I know you don't do a ton of interviews. It makes me all the more thankful that you choose to be here. Thank you, sir.
Thank you, Rachel.
So talk to me about your decision to step down and the timing to do so now. Is the fact that you're leaving now linked to that expected end of the emergency declaration? Does it indicate that the White House is on a kind of new footing when it comes to COVID?
No, I think the commitment is there. I've always believed in public service. I grew up in the generation that it was an obligation, it was a privilege to serve. But I also believe you come in and serve, and there is a time to leave. Let me assure you, there is a great team in place. That you don't hear their names at all. You know, the Jason Roos, Kim Armstrong, Steve Cha, Julie Turney, Lisa Barkley, they are there. They will stay there. And I assure you, this president is fully committed. He's made sure that we've had everything we needed to get us to this point. It's been an historic accomplishment, what this country collectively has done. You know, my thanks to my predecessors at Operation Warp Speed. Never in the history of public health will we ever do what we just did. 660 million vaccines in arm, 13 million antivirals administered, 600 million doses donated. It just is an incredible accomplishment. Where we are, the virus is not done with us yet. It will still evolve, but I think the chances are low, not non-existent, but low, that it will revert to the kind of mortality that we saw 2 years ago. To any skeptic, look at those pictures of China. One of the major reasons we don't look like that is because of the vaccines we have here.
Dr. Kessler, you'll be remembered in history, among a lot of other things that you've done in your career. The only person to ever serve as FDA commissioner under two different presidents. Your incredibly important role on things like tobacco and nutrition and HIV and AIDS, and your role in fighting this pandemic. You'll be remembered specifically for having probably been responsible for keeping President Biden from getting infected with COVID before there were vaccines at that first debate in September of 2020. You'll be remembered for leading the task to get 100 million doses in the first 100 days, 100 million vaccine doses distributed in the first 100 days of President Biden's term. And those things saved innumerable lives. But I worry now when I look at the low level of uptake on those bivalent boosters. The bivalent boosters became available in the fall. They're a qualitatively different kind of booster. They protect us from the new kinds of variants that have developed since the initial round of vaccines came out. I worry that we're essentially leaving, more like 85% of the population vulnerable to new variants because people don't want to get the new boosters.
Our job, I saw our job, my job, is to make sure that anyone who wanted access to a vaccine or an antiviral that worked had that access, and that it was easy to get. And that was our job. We put it out there. We urge people to get it. As you said, 80% of this country, 225 million people had their primary vaccine. Look, no doubt, there's cases are still XBB, Northeast, Middle Atlantic now is going to roll through the United States is a fraction of what we saw. I don't know, Rachel, if you remember some of those nights that you and I talked. Some of those nights were pretty scary, right? Nothing like that is now. I think we're in a different place, but you're right. If you haven't had your bivalent booster, get it. If you're eligible for antiviral, if you get COVID, take it. We have to be vigilant. This virus is not done with us yet.
Dr. Kessler, in terms of those treatments, we've seen the monoclonal antibodies become less effective or not effective at all as the virus has mutated. Should we have confidence that as the virus continues to evolve globally, that we will continue to have antiviral treatments that help us, that reduce the hospitalization rates and keep people from dying once they do get infected?
We have a very effective treatment on the market. It's not perfect. And no doubt in my mind, we have to do everything we can to get another antiviral as soon as we can, just to have it. There's no guarantees in this business. You and I lived through the antivirals changing the course of HIV. Yes, there's a great antiviral in Paxlovid, but we need to continue to make sure that that remains the case.
Dr. David Kessler, stepping down as the Chief Science Officer for the Biden administration's COVID response. Dr. Kessler, thank you so much for your service and for talking with us over these past couple of years. I look forward to staying in touch and to seeing what you do at UCSF.